Good afternoon, Yorktown. It's Supervisor Matt Slater coming to you from Town Hall with another COVID-19 update. I'm joined once again by the Westchester County Commissioner of Health, Dr. Shalita Amler. Dr. Amler, thank you so much for joining us today.
My pleasure.
I just wanted to give a quick update on the numbers where we stand today. We have 8 new cases in the town of Yorktown. We have 181 active cases, and as Dr. Amler is going to explain a little bit, just like other communities, ours has seen a little bit of an increase over the last, call it week, but I think in the last 48 hours we're starting to see a more downward trend, which is very good for us to report on. Town government continues to operate, and we are working towards reopening our facilities to the public in the coming weeks, so we'll be able to provide more information on that. Obviously, it's a fluid situation. We want to make sure that whatever we decide to do, we do with the safety of our employees and the safety of our constituents, of course, first in our mind. Our restaurants are at 75% capacity these days, which is great to see. So if you're looking for something to do this weekend, I know that our local restaurants would welcome the additional support, and that, again, that capacity is at 75%. And our vaccine pop-ups have continued in the town of Yorktown, and I really want to thank, first off, I want to thank my staff. Jenna Belcastro and Kira Brunner have been just phenomenal in organizing these pop-ups as they've become available. And I want to thank our partners. It's been just a tremendous opportunity for the town of Yorktown. This week alone, we partnered with Acme, the Albertsons, the company, the pharmacy company that they have. But Acme provided 300 vaccines on Monday, and yesterday Taconic Pharmacy up in Jefferson Valley, they provided 200 vaccines, all at the Albert A. Capellini Community and Cultural Center. As a reminder for those who are still looking for vaccines, you can always go on to yorktownny.org. We do have a link for you to sign up so you can be on our standby list. These pop-ups are exactly that. They just pop up. We don't know when we're going to get them. They are predicated off of the state releasing doses to our partners. So when they get their allotment, they tell us how much, if any, that they can provide, and we jump into action and quickly provide this great service for our residents. And we're going to continue to do so, again, as long as our partners continue to receive those doses. But I want to bring in Dr. Amler to provide some updates for us from the county's perspective and to give us an idea as to how things are going. Let's start again with the biggest thing that we keep talking about, which is the vaccine.
Yeah, and since we're about 12 feet apart, I think I'm going to take this mask
off. Yeah, no problem. I'll gladly take mine off,
I think we're far enough apart that I don't need to wear that. Maybe people can hear me a little bit better.
Great.
So I know that here in Westchester, we have about 163,000 people who have completed their vaccine series. And we have over 304,000 people who've had their first dose.
That's great.
And that represents about 30% of the population with at least one dose. So that's really good. So we have been seeing both Pfizer, Moderna, and Johnson & Johnson vaccine. And I do get questions all the time from the public, Dr. Amler, which vaccine should I take? And the real answer to that is whatever vaccine is available to you, because they all have wonderful efficacy. I mean, these vaccines are really work better than any other vaccine that's been developed. The efficacy is somewhere around 95% for most of these vaccines. So that's very, very good. I wouldn't wait wanting one over the other. If you have the ability to get Pfizer, you have the ability to get Moderna, get whatever you can get. Some people, kind of want to wait for the Johnson & Johnson because it's a single shot. But I would say that, while you're waiting, you could be exposed to COVID. You could develop COVID, and you don't know what the outcome of that will be.
Yeah.
So the best thing is the minute you have the opportunity to get that vaccine, take it. And I still have a lot of people, for whatever reason, are just like, well, I think I will wait. There's advantages to being vaccinated. Right now, if you're fully vaccinated and you travel out of the state, you don't have to quarantine when you come back. That's a huge bonus.
Absolutely.
And just knowing that you're doing everything in your power to not only make yourself healthy, but to keep from exposing everybody you care about. Because if you get COVID, everyone that you are around, you're potentially exposing, and you don't know who of those people might have a bad outcome and could potentially die.
Right.
So, if you care about your family, it's really
Take the
an act
vaccine.
of love
Yes.
to take the vaccine.
One of the questions I get about the vaccine is if I'm vaccinated, can I still carry COVID and expose somebody else? Would you be able to answer that?
Right. The vaccine is not a live vaccine. So they don't actually use the COVID virus to make the vaccine. They use, for both Pfizer and Moderna, they're using a piece of the messenger RNA. It's like a blueprint for a part of the virus that is, it's on the outside. It's the little spikes that you see. It codes for just a tiny piece of that. So you're not actually getting the virus. It's not a live vaccine. It's not an attenuated viral vaccine for Pfizer and Moderna. But it enables our body to recognize that little tiny piece of protein, know that it's foreign to us, and to eliminate it from our bodies. So no, you can't spread it because you're not being given the virus.
Right. And then when you get the second shot, whether it's Pfizer or Moderna, we keep hearing that people are having these reactions, right? You feel whether it's fatigued or flu-like symptoms. But I think what people don't understand is that, and correct me if I'm wrong, but that's your body actually recognizing what the first shot was
Right.
did, and
Exactly.
is reacting properly. So you actually want to have
Yeah,
that type of
it's
reaction.
great. When I got my first shot, I had nothing. I had no sore arm, no redness, no fever, no headache, no nothing. And I was actually a little disappointed. And I'm like, oh my gosh, is this even working? Am I going to have any immunity at all? And then when I got my second shot, I had a little bit of a headache, a little bit of fatigue, and I was actually relieved to have those symptoms.
Yeah.
I do say most people typically have little reaction to the first one, and if they're going to have a reaction, it's more to the second one. And typically reactions occur more in younger people than older people, because younger people have a stronger immune system. As as a general rule, their immune system is more robust than older people, and so they're more likely. But I think it's a good thing that when you plan to have that second shot, kind of take it easy the day after.
Plan it accordingly.
Plan it accordingly. Yeah.
Absolutely. And we hear these things about variants, right? So we've got the British variant, you've got the Brazil variant,
South Africa.
South Africa as well. So do we know yet how these vaccines are doing in combating those variants?
So far, the vaccines seem to be effective in preventing even COVID of the variant form. The concern is that will that continue, and as new variants potentially develop, will the vaccine continue to be effective against them? We don't know. And so actually, that's something that CDC and other health authorities are continuing to monitor. They monitor for the presence of variants, and they monitor people who test positive for COVID to see if they are carrying a variant. And so what we would like to have happen is that we reach herd immunity as soon as possible.
Yeah.
Herd immunity is when we have about 70 to 80% of our population vaccinated, because then we'll have less COVID in our population and less risk of variants in our population. So want to get everyone vaccinated as quickly as possible, so that hopefully we can prevent the development of
Do we have any
variants.
sense how close to herd immunity we may or may not be? We're nowhere near. is
We're
my
nowhere
guess.
near there yet,
Yeah.
but really, when people stop to think about the fact that all this happened just a year ago,
Right.
and here we are with a vaccine in 9 months.
Yeah.
I don't think most people understand how miraculous that is. I mean, it used to take 10 to 20 years to develop a vaccine.
Exactly.
So that we as a country have been able to do this in 9 months and start vaccinating people is almost like a miracle.
It really is.
It really
astounding.
is. It's a medical miracle. And so we luckily have multiple vaccines, and there are more coming. AstraZeneca, may be looking for its emergency use authorization next month. And I think, we just need to get people to be willing to accept the vaccine.
Right.
And to trust that that these vaccines not only are effective, but they're really very safe.
Yeah. Now, the other thing you mentioned travel. Was there an update from the CDC in regards to quarantine if you're vaccinated? Do you still have to quarantine if you come into contact with someone
If
with COVID?
you are fully vaccinated, it's been at least 2 weeks since your second dose, you have no symptoms, and it has not been more than 90 days since your last dose. That's a lot of
Yeah, that's a lot of ifs.
A lot of
Yeah.
ifs. You don't have to you don't have to quarantine.
Okay. But there's so again though, so you get quarantined. I saw that Rutgers University is actually requiring proof of quarantine in order to go attend their classes this fall. But so
You mean proof of vaccine?
yeah.
You said quarantine.
Oh, I'm sorry. Proof of vaccine. Excuse me. Proof of vaccine. Apologies. But the now I just lost my train of thought. But the benefits of the vaccine: travel without restrictions, and then again, if you hit all those
Being
markers,
being safe.
exactly. But you don't have to quarantine.
You don't have to
if you
quarantine.
become exposed. But as you said earlier, you really are protecting those around you. So
And that's the most important thing.
Exactly.
I mean, it isn't just about yourself.
Right.
It's really about everybody else around you.
right, and we've talked about that before.
Especially children, because we cannot currently vaccinate children. So, the youngest we can go with our vaccines is Pfizer, which you can vaccinate someone who's at least 16 years of age. But if you're younger than 16, there's no vaccine currently available.
Right.
Vaccines are in the process of being studied for the pediatric population, but currently there's none available. So we can't vaccinate young children. So what we can do, though, is we can vaccinate the people around the children.
Right.
Their parents, grandparents, other people in their environment, and in a way we're providing herd immunity to them because we're surrounding them, we're cocooning them
Right.
with people that are vaccinated and are safe so that they don't become ill.
I got to tell you, when we're calling through for our pop-ups, I'm pleasantly surprised with how many people who are on our list but have either already scheduled a vaccine appointment or have already received the vaccine, especially our teachers, because we have a special list for teachers since pharmacies are able to vaccinate them. And it's been very it's been great to see how many people I think have actually received the vaccine, especially our teachers, which is critical for our schools.
And it's wonderful because everyone wants children to go back to school. We all want the kids to go back. It's been so hard on the kids not to be able to see their friends, their peers, have their activities. But beyond that, it's very difficult distance learning, and especially for some children who really, learning may be a little bit of a challenge to begin with, and learning in front of a computer with no real person-to-person input can be very, very difficult for those children. So we want to hopefully get kids back to school as quickly as possible. I will say the schools that have been in person have been doing a really good job, and we've really had very few cases of COVID where it was actually contracted at school. And when we do see children with COVID at school, that cases become known to us, it's usually more around a sporting event where a team was playing whatever, and they were a group of kids that were exposed to somebody who within that team who tested positive, and then because they had close contact, they go on to develop COVID themselves.
Gotcha.
So, but the schools have been doing a great job.
They have been. Actually, this week, my son, who attends one of the elementary schools, it was his first in-person for the entire week. So he was pretty tired, I heard, when he came home from school today because it was his first full week. But we're getting there, and we're making the progress. And the schools, I think both or all four of our school districts here in Yorktown, because we also have Croton and Ossining, they've all done a fantastic job.
Yep.
They've all been committed to bringing the students back in a very safe way. I've been so impressed with how they've achieved that, and also so impressed, by the way, with our teachers, because they've gone above and beyond in the last year in ways that we never expected them to have to in order to teach our children, and they've done just a great job as well. But speaking of schools, it is spring break coming up, and I know that's something that you and I wanted to talk about. And so there is no school next week for our school districts. What kind of safety suggestions would you have for my fellow parents with their kids being home, or if they're traveling?
So, first of all, we're hearing from the governor's, it's on his website, that he may be doing some changing around travel restrictions as of April 1st. But I have nothing in writing yet, so I can't say whether or not there will be travel restrictions after April 1st, but there's some indication that there may be some changes there. So people should stay tuned, check the state's website if you're traveling and you have an interest in that. We do have concerns about travel, largely because of the variants.
Right.
The CDC is quite concerned about the transmission of variants and how that may, people travel, they're exposed, they pick up a variant, they bring it back to their community, they spread it within their community. So there is some concern there about COVID being spread. So I would say that it's very important that when you travel that you are exceptionally conscious of all the things that we've done so far. I mean, if you haven't gotten COVID to date, keep doing all of those things. And when you travel, do that really very religiously. Wear your mask, use hand sanitizer, social distance. A lot of airlines are still providing, a middle seat that's empty.
Yeah.
Wear your mask when you're on the plane. Wipe your area down. The few times that I've flown lately, I take sanitizing wipes with me. I walk down the armrest, any place I'm going to touch,
right.
My tray, the front of my seat, any place that my hands might touch, I'm very conscious to wipe that off before I sit down.
Mm-hmm. That's great. Those are great points. And what about in regards to those who are not traveling? We heard you say earlier that you've seen cases amongst teams. So if our kids are going to be home this week, any suggestions for parents about how we can make sure that the kids stay safe and can return back to school the following week?
Well, remember, we still should limit no large groups, and so in home it's still at 10.
Mm-hmm.
And so you just want to be conscious about avoiding crowds if you can. I mean, and if you are in a crowd, continue to do 6-foot distancing, wear your mask. I mean, it sounds like a broken record, but a lot of people have not gotten COVID over the last 15 months because they've been doing these things.
Right.
And so we're almost to the finish line, and you don't want to be, this close to getting a vaccine and get COVID.
Yeah.
You've made it this far.
Right.
So please continue to do all the things you did that kept you safe to this point until you can get a vaccine. For the children, since we can't vaccinate them, it's even more important.
Let me ask you this. If this is an interesting one. I had someone who received their first dose of the vaccine and then tested positive for COVID. What happens to their second dose? Are they able to get it, or because they have the antibodies, they're going to have to wait the 90 days?
No, they are able to get it, but it must be at least 10 days from their diagnosis, and
Okay.
they must be symptom-free. You don't want to go get your second dose if you're sick.
Right.
I mean,
right.
because then you don't know, is this a reaction to the vaccine, or is it just the COVID that I had? So you want to be completely well before you go get your vaccine. But you can be vaccinated, It's that's just bad luck. The problem is
it really is bad
It
luck.
is bad luck. But I will tell you that remember that you're not considered to be fully immunized
Right.
until 2 weeks after that second dose, or if you had Johnson & Johnson, 2 weeks after the single dose that you got. So you get that first dose, you're not fully immunized. You still need to be very protective of
Right.
yourself. And even if you get that second dose, you could still, if you were exposed right before you got that second dose or immediately after you got that second dose, you could still go on to get COVID. But what will that vaccine do for you? Even having a single dose of vaccine hopefully will mean that you have milder symptoms and a reduced risk of dying. And isn't that what it's all about?
Exactly
I
what
mean,
it's about.
it's all about not dying. So I say to my staff all the time, no one wants to get sick, but I'd much rather get sick and not die.
Right.
And so that's the importance of getting that vaccine, because what all the studies have shown is that the people who've been vaccinated, even if they went on to get COVID, they didn't die.
Right. Now let me ask you this. You get your second shot. You're 2 weeks after your second shot. Are we still wearing masks?
We are, because even though I tell you that the efficacy is 95%, that's not 100%.
Mm-hmm.
So even if you've had 2 doses of vaccine, you could still go on to get COVID.
Right. You still have a 5%.
You still have a slight chance of getting COVID. So you still want to take care of yourself. But like I said, even if you do go on to get COVID, your chances of having a very bad case and having a really bad outcome are substantially reduced.
Excellent. So let's, if we can, just pivot quickly to summer. And we're all hoping for a more normal summer to the best of our abilities. Everyone wants it. Summer camps. It's something that is starting to be explored again here in the town. We had our Parks and Rec superintendent join our town board meeting this past Tuesday night, talking about their plans for summer camp. Can you, from your standpoint, discuss your opinion on summer camps, whether it's the Department of Health's position on summer camps, as a parent, but also as we look to provide that service to our community again this year?
Well, we're waiting for our guidance from the state around summer camps, but we understand guidance will be coming and that summer camps will be allowed to proceed. Exactly in what form, I don't know yet because I don't have the guidance. I think it's important for children to be able to get out and be with their peers. I'm sure that there's going to be masking and social guidance as a part of that. And I'm sure that, we're really going to encourage the adults who are working, anyone over 16 who's working in a camp, to get their vaccine so that they're not, they're not spreading it. They're not a potential source of spread to the children because we can't, as we said, can't vaccinate the kids.
Right.
So, but, I know that everyone is looking forward to it, and we're very hopeful that that's something we're going to be able to do this summer.
And what about public pools this year?
Again, I think exercise is really, really important. You can't wear a mask when you're in a pool. It's a risk of choking. It's just, not recommended. But we would recommend social distancing in the water. Families can stay in their pod, so to speak. So if you've got parents with their children, they can certainly frolic in the water together, stay close together, but we would encourage them to keep their distance from other swimmers.
And, of course, social distancing. Last year, we did open the town pool. We opened one of our town pools, and we had social distancing circles throughout the entire facility, which was, I thought, ingenious of our parks department, our parks superintendent to install. But I would assume we should expect the same this year.
I think that's exactly what you're going to see. And just remember that, if you're laying out, getting a suntan or whatever, keep that social distancing even there as well.
Okay, great. Well, Dr. Amler, I really appreciate your time. Appreciate you coming back up to Yorktown. You've been so supportive and always there when we need to pick up the phone and reach out to you and your staff to provide guidance to us as we continue to find our way through this terrible ordeal. But to your point, hopefully we're nearing the end. And the vaccine plays a very, very important role in that. So, again, thank you so much for your partnership.
You're welcome. And I would just say that, if people have an interest around the number of cases in their county or the number of vaccines in their county, they could go to the New York State COVID tracker, which will give you the number of cases, and you can look it up by county or by the state. And also New York State COVID vaccine tracker, which will show you how many vaccines are being given in the various communities in our state. And good way to take a look and, keep track of what's going on in your community.
Yeah, in addition to that, on the Town of Yorktown's website, we do have our Community Impact Dashboard. We continue to update that as we get more data as well, so you can see what's happening right here in the town of Yorktown. Again, I want to thank our special guest, Dr. Amler. To the residents of Yorktown, we'll continue to communicate any and all information that we have once it's obviously validated by our partners at the Department of Health, and we make sure that it is accurate. But we want to make sure that everyone enjoys a very happy Passover for those who are celebrating, and of course, stay safe during this spring break. Until then, we'll talk to you soon. Thanks, Yorktown.